I started something.
Yeah.
You guys all got sign in?
Yes.
So we all.
Also working to address homelessness. At the final meeting on the issue, we took a closer look at what action.
Are they on target? Those four?
Good evening, everybody. Jim Stairs will not be able to be here tonight. This is Alan Bell. I'll be leading the meeting tonight. I'm just waiting to hear, I'm remote tonight, just waiting to hear from Tim or Carol or whoever's at Remo on whether or not we have a quorum. And we'll get started.
Carol is tallying it up now.
Working.
Thank you.
Oh, Maria's on, so she was excused.
Lynn was gonna be here, Otto, speak to you. She has COVID. She's gonna do it from home though. So make yourself comfortable.
Hey, home.
I don't know who that is, 48.
1, 2, 3, 4, 5, 6, 7, 8.
Carol, it's Maria. I'm just listening in. My students are taking a final exam.
We hear you, Maria. 16, 17, 18, 19, I think. I do.
Alan, it's Tim. Carol just tallied it up. You're good to go.
All right, thank you. We'll call the meeting of the November Regional EMS Council to order, and we'll start off with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The prior minutes were sent out to everybody. If there's no issues or questions, we'll move on. Any excused Remsco members tonight? I don't have any listed, so unless something's come in last minute, we'll move right
Alan,
on.
that would be Maria Walker, but she is listening in from Hudson Valley, and Jim Stairs.
Oh, that is correct. Jim is not here. That's why I'm doing this. All right, thank you. Tim, it's all yours.
Okay, before I kick off, Alan, I'll ask if Lynn Kane can be put on. Lynn's doing battle with COVID tonight, but she is on remotely. And she would like to speak to membership. We could get her done before anything else if nobody objects.
That would be perfect. Lynn, it's all yours.
Thank you, Alan. In needing to clean up the membership list, when Scott left and it took a while for someone to come back on board as chairperson. So I'm going to make a couple of motions. Members who have expressed interest in retaining their seats. The first would be Maria Walker. Maria says she would like to continue. So I would make a motion that we reappoint Maria to a 4-year term. Is there a second?
I'll second that. Alan.
Okay, so Alan, you get to ask them
Unmuted us.
who
Okay.
agrees, who doesn't, that kind of
All right,
stuff.
the seconded motion is for Maria Walker to be reappointed to a 4-year term of the council.
Yeah.
Any discussion on that? 'Cause, 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 Hearing no discussion, I guess we can vote on that. We'll kind of do it the opposite way. Is there anyone who objects to that?
Great.
Does this need to be a roll call vote or no?
Hi,
I'm-
this is,
sorry.
hi, this is Steve. Alan, I think because it's a membership vote, you actually have to do, not a roll call, but you have to do all in favor, then you have to give people a chance to say no and abstain. I mean, I'm assuming it would be perhaps unanimous, but I think because it's a membership vote, it's a statutory vote, and I think you should ask for yeses, nos, and abstentions.
Perfect, Steve, that's not a problem. We can do that. So again, the motion is for Maria Walker to be reappointed to a 4-year term. So all those in favor signify by saying aye.
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 And all those opposed signify by saying nay. And are there any abstentions?
I should probably abstain from this one.
Okay, Maria is going to abstain from her own vote. Being that there were numerous ayes and 0 noes and just 1 abstention to this, the motion passes. Congratulations, Maria. 4 more years.
Thank you.
The next one would be Anne Marie Cross. Again, she's expressed an interest in remaining on the council, continuing as head of the nursing committee. I make a motion to reappoint Anne Marie for another 4-year term.
BJ seconds it.
BJ seconded it. Did you hear that?
Oh. Yes, I did. So we have a motion and a second to that. The motion is for Anne Marie to continue on for another 4-year term and to retain her head as the nursing committee chair. All those in favor signify by saying aye.
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 Any opposed signify by saying nay. And any abstentions? Hearing no negative votes and no abstentions, the motion passes. Congratulations, Anne Marie.
Who's home battling sickness herself. She's
No,
sick
she's
of it.
right here.
Nope, she's here.
Oh, she's here. Okay. Next would be Dr. McHugh. So he needs to be reappointed for another 4-year term. I make a motion that we do so.
I'll second.
Okay, so we have a motion and a second. Any discussion on that? Hearing none. The motion is for Dr. McHugh to continue on for another 4-year term. All those in favor signify by saying aye.
Aye.
Aye. Aye.
Anybody opposed signify by saying nay. And any abstentions? Hearing all affirmative votes and no abstentions, the motion passes. Dr. McHugh, congratulations on another 4-year term.
The last of the members to be reappointed would be Charles Wedge. I make a motion that he be reappointed for another 4-year term.
I second that.
All right, motion by Lynn, second by Carol. The motion is for Charles Wedge to be continue for another 4-year term. Any discussion on that? Hearing no discussion, all those in favor for Charles to continue on a 4-year term signify by saying aye.
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 Anyone in opposition to that, please signify by saying nay. And are there any abstentions?
Charles will abstain, he says. He's here.
Okay. So all affirmative votes, no negative votes, and one abstention. That passes. Congratulations, Charles, for another 4 years.
Then the next item would be, we had an application for one of the at-large seats, vacant at-large seats by Otto Matson. Well known to the committee. We met to discuss it, and I present the motion to the council to appoint as Otto Matson as an at-large member of the council for a 4-year term.
I'll second.
Okay, we have a motion by Lynn and the committee, a second by Jim Vanna, for Otto Matson to be appointed to a 4-year at-large term. Any discussion on that? Hearing no discussion, all those in favor of Otto being appointed to a 4-year at-large term,
You're
signify
right.
by saying aye.
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 Any objections to that motion, please signify by saying nay. And is there anyone who needs to abstain from that vote? All right, hearing all affirmative, no negative votes, and no abstentions, the motion passes. Otto Matson has been appointed to a 4-year at-large term.
Very good.
Congratulations.
Hi, Alan. This is Steve. Can I ask Lynn a question?
Of course you can.
Thank you. Hey, Lynn, is Otto with us tonight?
He is, he's here.
Maybe it would be great if he would just, I mean, most of us know him, but in case anyone in the council doesn't know him, he could introduce himself to us and tell us just a little bit about his EMS history and background.
I think that's a wonderful idea.
Sure. Thank you. Thank you for the confidence in the vote, and I'm happy to be on board. It's been a number of years since I've been involved in that capacity. Started my EMS career back in the early 80s. Hudson Valley Paramedic School in '89. Been actively providing as a provider since that time, back in the 80s. Been an instructor since the latter part of the 80s, early 90s. I've worked and taught here at Remsco for many, many years. Involved, currently retired from the City of Coast Fire Department in January. Currently actively teaching and working with Mohawk Ambulance Service. Now I've been with Mohawk for about 7 years. Ran Capital District Ambulance for 14 prior to that. Empire for about 15 or 16 years prior to that. Been around a little bit. Anything
And
else?
thank you very much for being willing to volunteer.
Well, thanks, Otto. Welcome aboard. We are grateful to have you.
Now, Alan, that was the end of the membership report. I have one other thing I'd like to mention. I did some research late this afternoon, looking at the most recent bylaws that were amended in 2018 regarding changing a bylaw, as was email discussed through the surveys about changing the months that we're going to meet, and the discussion by Tim if we were going to have a meeting in December. Article 5, paragraph 2 states that we will, with previous notice, be able to vote on it. I don't feel that the emails around was enough of a previous note, but being in the permanent record for tonight would make it a notice that we then would not meet in December, because we don't typically, and start off 2024, February of 2024, as the meeting upon which we would vote for the change. We could do January. I'm just saying, since that's where we're gonna go, if it works. But it is, and specifically, the bylaws say that we need a majority of the membership, not just the members that are attending.
Lynn, just so I can confirm the bylaw that you're talking about, the one that I'm looking at is May 21st, 2018. Is that the same
Yep.
one you're looking at?
Yep,
Okay, so just to clarify, that'd be Article 10.
Article
paragraph
10.
G.
Oh, yes, it is. I'm sorry.
That's not a problem
Roman
at all.
numeral. I apologize.
COVID fog, we all get it.
Oh, gosh.
And what does Article 10 state?
Article 10 states if any provision or portion thereof of the bylaws is or be, I'm sorry, it'd be paragraph A that covers this, and it'd be proposals valid for amendments to the bylaws shall be acted upon at a regular meeting, provided that the text of the proposed amendments or a statement of substance thereof shall have been presented at the previous meeting and included in the notice of the meeting at which action is to be taken. Amendments require adoption by a majority of the total membership. Basically, I would agree with Lynn basically on what she said. This was not presented as an amendment at the last meeting, so I don't think it would be proper for us to vote on it at this meeting, but certainly we can have discussion about it if anyone sees
Alan,
it.
Alan, I agree. This is Steve, and I have a suggestion for you and for Tim. Rather than put the exact month meeting schedule in the bylaws, perhaps it would be good to work with Terry Hannigan to draft a bylaw amendment that gives the council discretion so that you don't have to change the bylaws. Let's say in a year, we decide we want to start having meetings in the summertime. Well, rather than have to rechange the bylaws, if the bylaws give the council permission to determine how often it shall have regularly scheduled meeting, like it could be a bylaw that says the council shall determine when to have regularly scheduled meetings and not less than 6 meetings per year, for example, would give flexibility to the council to make changes without having to do a full bylaws amendment.
Yes, sir. I agree with that.
I think don't quote me which part it is, Article 30, whatever outlines the regional councils. I believe it specifies meet as often as required to, complete business or something like that. So we could probably just take the verbiage right out of the regulation. And I think that would give us the flexibility.
That is a great idea.
And we do have the further on or further before in the bylaws, we have a section where the majority at a meeting can change or reschedule any meeting it deems necessary.
Okay.
I think honestly, it might not be a bad idea to have the bylaws committee get together and kind of go through the whole thing one more time, just to make sure we're happy with the rest of it too.
Okay.
Just a thought.
I
Well,
think that is a great suggestion. So let's
Alan.
schedule. Yeah, go ahead, Lynn. Sorry.
well, because it was Maria, Anne Marie, Carol, Scott, who's no longer with me, and myself as chair. I'm sure us ladies can get together and make short work of the review. Think so, Carol?
Probably. We could also solicit more input if we'd like. That would be good.
So perhaps we can come back with so Steve Kroll,
I
what do you
I
think?
wouldn't mind helping out.
Thank you, Adam.
I think the first step will be, well, we should probably get a copy of the bylaws out to everybody anyway, the current ones.
Mm-hmm.
And then have people kind of review it and provide some input to the committee so that we can maybe get them nailed down once and for all. Or once.
Okay, so what we'll probably do is not meet in December, meet in January like we normally do.
Yeah, that probably makes sense.
I think so. What do you think, Steve Kroll? Make sense to you? Looks like he's having computer problems. Steve, you're muted. We can't hear you.
my personal opinion is we should be meeting monthly and coming up with other important items to work on. So, but I am not in the majority. So, if meeting in January gives you more time to work on the bylaws, though, I think it then, it makes sense to, I mean, obviously you need a couple weeks to bring people together to do it. And we have to make sure, not only we send out a copy of the current bylaws, but we should very much send out a copy of any proposed changes with, in advance of the meeting notice, and then again with the meeting notice, so everybody clearly has got it if we're going to vote on it.
Like what we did when we modified those bylaws back in 2018.
Yeah, you did a good job with that.
Right. I bring that up, Alan, just because you and Jim Stairs, I mean, he wasn't chairman at the time. I was just trying to be helpful by doing a little research.
I appreciate that, and that was the bylaws are actually up on my screen to discuss that later on. So I appreciate you bringing that up, and kind of glad to see that we're on the same page with that. So it sounds like we're gonna the committee will meet. Tim, if you wouldn't mind sending the current bylaws out to everybody so they can respond back to the committee if they have any suggestions and things to be changed. And then we'll go from there. Clearly later in the meeting, we'll have to discuss whether or not we're going to meet on Christmas or not, or the day after Christmas, but we'll figure that out.
Alan,
Yes.
I feel I speak for the membership. You'll be in a class all by yourself.
I figured.
I know I'm being presumptuous. But.
So, but that being said, also in the bylaws, the January is the annual meeting, so we will have to hold a meeting in January since the bylaws are currently still in effect. So.
Okay, so at the January meet, you will have a discussion about whether we're meeting in December, though at this point, nothing else has been suggested. The bylaws committees will meet and come back at the January meeting with proposals, and we'll discuss it at that point.
Sounds like a plan.
Okay.
And then we can make any presentations at that meeting, and it can be voted on at the following meeting.
Okay, I'll work with Tim after the committee decides what they want written out, and Tim can disseminate it to the membership before the January meeting.
That sounds like a great plan. Thank you, Lynn.
Sure thing. And thank you for allowing me to go first. I'm going to stay on as long as I can keep my eyes open.
Understood. Thank you for doing all of that. All right, if there's no objection, we'll get back into the executive director's report. Tim?
Sure. The remote DOH fast track EMT class just wrapped up. 19 students passed the PSE and they're eligible to sit for their written exam. The next Skidmore College class, which starts in January, already has 30 students enrolled. So we're going to cap that class. That's good news. And some more good news. So far, we have 20 students registered and paid for our Remo Spring EMT class here. Our new front desk assistant, if folks remember, Amanda Kimler, was just short-term here anyway. She's going to wrap up by the end of the year. So new front desk assistant, Kim Krings, has been coming in a couple days a week to sit with Amanda for some on the job. She's picking it up well out there. So we're happy to have somebody replace Amanda when she leaves and not have a gap at that front desk. We've completed the Remo renewal for the New York State opioid program. So we're good to go for another year or 2 years. I forget what that registration term is, but we're all set there. I attended the ARMS monthly meeting on November 16th. They had 2 CON votes out there, and they gave an update on the REMAC membership. They were a little sparse with REMAC members, but they just picked up two additional doctors, which is very encouraging. And Dave Kowalski, our finance coordinator and I have been working with Beth McGowan. Beth McGowan has assumed the Remsco secretary position out there since Phil Malidi retired. We've just been working with her to help her pick up some of the responsibilities that she's inherited. Most of that has to do with Remsco stuff, but Beth really wasn't familiar with that. So Dave and I have been working with her relative to contracts, deliverables, the vouchering process, stuff like that. We're happy to help her, and she's picking up on that. That concludes my report. I'll entertain any questions if anybody has any.
Tim, how many did the fast track class start with?
Almost 30 people. Yep.
And from the last, did you ever get an opportunity to speak to those?
JC is working on that. JC is going to contact all people that either dropped out or for whatever reason stopped showing up. We're trying to find out how we can encourage or sustain membership in the fast track classes. It was a bit of a problem the first one, but especially apparent this class where we started out with a robust registration of just about 29 or 30 people, and we wrapped up with 19 people. But we want to find out why these people aren't completing that class. So JC is in the process of contacting those people. So you can get an idea how we can stave off something like that if we hold another fast track.
Tim, along those same lines, do we communicate with the people who actually do finish the class about the struggles and complications that, they had during the class, but they were able to power through?
Yep, all the instructors hold an exit interview or exit survey. I'm just waiting for the results from this class.
Excellent. Thank you. All right, anything else for Tim? Chairperson's report. I don't have anything from Jim to report. Tim, did he have anything that he wanted you to talk about on his behalf?
Nothing I'm aware of, Alan.
All right, we'll go right into the medical director report, Dr. Daly.
Alan, thank you. I appreciate it. I wish I had better news. Unfortunately, I don't have to tell anybody on this call that we're one more time are facing significant offload delays. I know that each of the hospitals is struggling in their own way in order to try to resolve some of those issues. But over the course of the month of November, there were some significant volume related issues, particularly at the medical center and at least one of the Trinity facilities. Don't have any answers. Each of the emergency department management teams is working pretty hard to try to resolve that. It just remains a pretty significant issue. From there, some of the process improvement things that are going on across the Albany Med System, certainly continued work on STEMI stroke and trauma. Among the things that we'll be looking at from a trauma perspective in particular will be secondary transfers of patients who had the potential to be transferred, or excuse me, to not be transferred in the first place. That's been an intermittent project over the course of the last probably 10 years, and is usually a follow-up of specific cases to agencies. I don't see any specific trends with that. I don't see any gross trends in missed stroke, for example, which is great. One thing I do see is delays in calls for STEMI and delays in transmission of electrocardiogram for STEMI, but I only see that at the Med. I don't know what's happening at the other cath facilities at this point. Hopefully we will be able to put together a group regionally to take a look at that. Certainly as we continue to advance with Pulsera as well. Something that has come up several times is if the EKG is being sent by Pulsera, can we go away from the LifeNet system that was funded by Remo in no small part? At this point, we can't. Very frequently, the physicians and the nursing access of communication does not allow that to be easily passed from one to the other. Although we continue to try to find ways to make that more effective. Hopefully we will get there. Syracuse is now using Pulsera across much of their hospital landscape. And we're going to look to see if we can take some lessons from there. But that's the majority of what's going on with us right now. Thank you.
Thank you, Dr. Daly. Anybody have anything for Dr. Daly? All right, Dr.
Anybody?
McHugh, do you have
Uh,
anything?
Hold on one second, Alan. Steve Meehan does have a question for the doctor.
Go ahead, Steve.
Hi, Dr. Daly. I know it may not be a question specific for you or for anybody else. I'm not sure if anybody from the Trinity system is on. I've been hearing from providers actually at a number of organizations that specifically St. Peter's, but other Trinity Health systems are not really using Pulsera to its fullest, not answering crews, and it's a concern, at least at the field level, that it's not getting used nearly as it's getting used at Albany Medical Center. I was just wondering if anybody could speak to that.
I think, Steve, the only thing that I would suggest would be if that's something that is being discussed by the crews, if we can get specific dates and times, give those to Tim. That's a great role for the region to take on, to pass that back through the nurses committee and through the REMAC, as well as the individual participants, so we can get a better sense of what's happening. If we only find that out intermittently like this, there's nothing to act on, because it most likely is specific people that need to just get re-educated. So the more granular the information is you can pass along, the better we'll be able to work with that.
Sure. Yeah, no, I'll try. From what I've experienced myself and what I've heard from, again, not just my agency, but others, is that it's pretty much radio silence on their part. No communications from the hospital.
Well, when you say no communications, do you mean that there's no communication when you send a call into them, or that there's no follow-up?
No communications during the call.
Oh, okay. All right.
Questions asked, answered, and then seems slightly redundant in that they are requesting all of the patient demographic information even after it's placed into Pulsera. So it calls into question, again, the overall usage of the platform.
Yeah, I would second that. I look at our Pulsera most mornings, and I would say 99%, if not 100% of the Pulsera channel sent to at least St. Peter's, there's no response at all. There's no follow-up at all, which that's okay. But yeah, then they need patient demographics, a chief complaint, all of the things in the Pulsera channel when we arrive. And so people are just getting a little frustrated with that.
Gotcha. Well, the more you can give us for specifics, the better we'll be able to follow that up. But thank you, because to both of you, this is the first I've heard of it. Please give me information to worwork with.
No, we will definitely. I mean, this was brought to my attention since our last meeting, so it's the first forum I've really had to mention it.
Yeah, when Pulsera launched it and everybody was figuring out how they were going to use it at their own facilities, St. Peter's, to their credit, has never changed how they use it. They've been radio silent since the start. So it's not necessarily a new issue, but as everybody else gets more and more comfortable with it, and everybody else starts using it more and more completely, it's pretty obvious that they are not.
Yeah, Dr. Daly, it's Ben Bornhorst from Rensselaer County here. From what we've seen at both Samaritan and St. Peter's, they basically have one computer screen that has Pulsera on it, and they don't, the registration staff has no access to it. So all that information we're putting in, they're not receiving, and they have no way to see it. So that's where a big disconnect is there. At least Samaritan acknowledges the call, and then so that we know that they've received it. But yes, across the board, St. Peter's rarely even acknowledges that we've sent it in.
No, thanks for letting me know. I would point out that you don't need a forum to bring something like this up, Steve. That's something that can be addressed with an email to me. Now I've got a project for tomorrow, so thank you.
Once you get those specifics, could you send it to me, Mrs. Emery, for the nurse committee? Because we did discuss this at our last meeting, and actually I have it in my minutes. St. Peter's and Samaritan said no issues when we talked about Pulsera. So it's interesting. If I had that, I could certainly bring it, and I will bring it back in January. Yeah.
All right. If there's any further issues with this, contact both Anne Marie and Dr. Daly so they can work on resolving this. Hopefully. All right, back to REMAC and academic, Dr. McHugh.
We did not have a meeting this month, so we'll have a report next month.
Perfect, thank you. Treasury report, PJ.
Yeah, this month is pretty unremarkable treasurer's report. Obviously, we're only 1 month into our budget season. The only thing that I would point out to you would be the still outstanding ARMS receivable, and that has to do with a contract with the state. They've been back and forth with Tim and Dave and Terry as far as some revisions and verbiage that they wanted in the contract. So they are working on it as we speak.
All right, anybody have any questions for PJ regarding the treasurer's report? Excellent, thank you, PJ. QI, Dr. Daly.
Same traffic you had from Rob, no meetings.
All right, and there was no CON committee report either. So moving on, information sharing, just to read into the record, the DOH disciplinary actions. Catherine Seipel of Yorktown Heights, New York State EMT number 447565, had her certification suspended for 1 year effective 11/1/23. The suspension was stayed pending further violations for 3 years. Sorry, pending no further violations for the 3 years, and was assessed a civil penalty of $1,000 for violations of Part 803 AL, 800.3 AM, 800.15 A12, 800.16 A12 and 3. Stephen Rivera of Carmel, New York State EMT number 427041, had his certification suspended for 1 year effective 10/17/23. That suspension was stayed. He was also placed on probation for 3 years and assessed a civil penalty of $1,000 for violation of Part 800.3 AM. Joseph George of Somerton, South Carolina, New York State EMT number 503074, had his certification revoked effective 10/20/23 and was assessed a civil penalty of $500 for violations of Part 800.16 A7. Christopher Langevin of Milford, Connecticut, New York State EMT number 153229, had his certification suspended for 1 year effective 11/8/23. That suspension was stayed pending no further violations for 3 years and was assessed a civil penalty of $1,000 for violations of Part 800.3 AM, 800.3 AL, 800.15 A12, 800.16 A23. That is all the DOH disciplinary actions. Course advisories, informational, RCA, RA, EMT course. is either coming or going on, not sure.
And that's the Rensselaer County Ambulance and Rescue Association. They have a new class starting up, and I lost the date, but perhaps Kathy Allen can advise the group.
I don't have the exact date, but it's starting any day now.
November 29th.
There is a EMT class that is starting November 29th. So now we have the date. Thank you very much for that. There are no correspondence per se. There was a correspondence that was sent in an email that and I forget who it was, I'm sorry. It may have been Adam, but someone had requested that we get a list of the current members and their terms. I don't know who has that list, but if that's possible to get sent out to the membership, that would be great.
I will be updating that list with tonight's appointments and reappointments.
Fantastic. You read my mind. I appreciate that.
No problem.
Committee reports. Steve Kroll, executive. Or I'm sorry, executive. Jim Stairs, there is none. Steve Kroll, finance.
No report from finance tonight.
And EMS council.
EMS council meets December 5th and 6th in Troy, New York. There are no changes since my report at the last meeting, but there are a lot of major topics on the agenda for this meeting. We'll be talking about Part 800 regulatory changes that have been going through the comment period. I think most people here have already heard quite a bit about those changes that will be implemented come next year. It includes changes in regulation for vehicles, safety, education, a lot of things that have been on the docket and worked on in the process for several years. Mike McAvoy, the chair, has appointed a group to work on performance standards. Every single Remsco member should have gotten an email from Mike asking for volunteers to work on the performance standards committee. We will be setting performance standards for all EMS agencies that will be written into regulation. And that committee's first meeting is tomorrow. It's chaired by Mark Philippi, who's from the Monroe-Livingston region. I think everybody knows that the new educational reimbursement numbers went into effect. So any subsequent courses that we have will be reimbursed for EMT at $950. So that's up from $700 at the beginning of this year. It's the second step increase we've had this year. The survey that I previewed with all of you last month on our workforce survey, that's going to be presented to the full EMS council, and then we're going to Remsco, and then it's going to be published. And that's a pretty good summary of what's going on. And if you're interested in tuning in, we're in the Hilton Garden Inn in Troy, and quite a bit on the agenda right now. Mike's got a very aggressive list of things that he's working through.
Mike, I see you're on the call. Is there anything you want to add to that EMS council report or Remsco report?
No, that's good. I think the other group that kicked off today actually is a credentialing group, and that has like probably about 50 members on it from all around the state, and is working on best practices for credentialing providers. So they'll be meeting every Monday for the next month or so.
Fantastic. Thanks, Mike. Anybody have any questions for Steve or any comments regarding the EMS council, state EMS council? Perfect. Anne Marie, Nurses Committee.
We met on November 16th. We had a good turnout. The only one that was not present was Albany Med. Pulsera update was our first item. And again, as I said, everyone stated that there were no issues with it. Most of them felt like they were using it. The only one who had an issue was Alice, who said that some of the EMS agencies are not reporting or are not calling in a cardiac arrest when they bring a patient to the ED. One of them specifically said from Ellis that it was a Mohawk ambulance, and Carol said that she would follow up with them regarding this, as she said she really wasn't aware of it. No one else said they had any issues with it at all and that they were using it. We did discuss the paid version of Pulsera, which has a lot more functionality. We had talked about that at one of our last meetings, and we decided to invite the Pulsera rep, I guess her name is Angie, they said, to our next committee meeting to explore our options to look at Pulsera for EKG transmissions and potentially not have to renew our contracts with LifeNet. We feel like we may be able to save upwards of $10,000 a year if we can do that. The other thing we talked about were the inter-hospital transfers. They just said that the confirmation of the transfer, receiving the patient in a timely manner, and still felt that there were times when it was due to EMS staffing that would cause many of the delays in transferring the hospitals, especially like to someplace like Albany Med. We talked about the hospital diversion notification, and at the last meeting, it was reported that Colony EMS said that they were receiving too many phone call notifications for the same diversion. We discussed that, again, if the Pulsera rep does attend our January meeting, perhaps we could streamline this. And I think as Dr. Daly said, and I had felt at the meeting too, that this may be an educational issue. I think some people know how to use it, know the functionality of Pulsera, maybe better than others or more than others. They have more information. So perhaps if we can have her speak to that, we may be able to fix some of these issues. So we're going to see if she can come to the January meeting. And then Carol discussed the MIST form, which is a handoff communication form for low acuity patients. And the hospitals who responded that were present on the call were Samaritan St. Peter's Memorial, Saratoga, and Ellis, and they all felt that no issues with offloading any low acuity patients, and they felt that the form would not be helpful to them. And again, and then we agreed that we would meet every other month, and we're looking at we're going to keep the third Thursday of the month, and our next meeting will be January 18th, 2024. Any questions?
I guess just question relative to the missed handoff form.
Yes.
Although they didn't feel that it would be beneficial, is that going to hinder an ability for EMS crews to use it?
Well, I don't know. They were pretty adamant. Even Carol was present on it, and they just pretty much
No interest in it.
There was no
whatsoever.
interest. I mean, she presented it, and for the most part, they all said that they didn't think that there were issues with low acuity patients, and there wasn't a delay in the in handing it off.
So Steve, it's Dr. Daly. I apologize that I was not at the last nurses committee meeting. The MIST form was adopted as policy by the REMAC 4 years ago. And that is still absolutely appropriate to be used. As you guys massaged it in Columbia County, that document is a appropriate and correct document to use for low acuity patients. And that's something we will continue to support.
Ben Bornhorst from Remsco County again. If I may, the reason some of the hospital systems, in my opinion, as a field provider, don't want us using a MIST to turn over low acuity patients is because they want us to continue to, in no better terms, babysit their patients until they can find a place for them. And that's simply what it comes down to.
So most of the patients that need babysitting, as you put it, Ben, probably don't actually qualify for the use of the MIST form. So if a patient actually cannot communicate on their own and therefore needs that level of attention, you can't drop them off of the MIST. They should fall outside the spectrum of that patient type. So the places that we've seen the MIST form fail is when it was used inappropriately on a patient with dementia, or a patient who had, the inability to sit in a chair. Is something else that creates other problematic issues at that exchange.
Dr. Daly, that was quite honestly, that was my hope, that it would get adopted, similar to what we were able to accomplish with Columbia County, because the associated form that went along with it gave a clear, we could say, protocol or expectation of the type of patient that would be utilized for this, thus not allowing much wiggle room at all to, alleviate those instances where a particular crew would leave somebody who may be altered or unable to sit unassisted in a chair. That was, quite honest, like I said, that was the hope with creating that other document, what made it, quite honestly, very fruitful in Columbia County. That's why I'm sad to hear that the nurses committee thought that it wouldn't be beneficial without at least attempting it. I think it'd be less beneficial to not have a document like this and then allow it to be, as it is now, a free-for-all. And then that frustration and tension between the EMS providers and the facilities would just perpetuate.
No, well said, Steve. And I think what's important here is the clarification that you guys made to the document that we originally released was all quite positive. And, quite frankly, I think either Dr. McHugh or myself should take your document, update ours, and reissue it as an advisory, because it's just what needs to happen at a patient exchange. And to point out, if that information has already been placed into Pulsera, the MIST can be much more brief. And we should update the MIST form to reflect the fact that a Pulsera communication between a nurse and the EMS provider has already occurred. And therefore, that exchange and the transfer of care is basically complete. So we need to make sure that we clarify that appropriately, place it in an advisory, and allow that to impact care.
I agree.
If they're not using Coursera, that's probably one of the bigger reasons, because they're not seeing any of that information, right? I mean, as it was said, that's a concern, right?
You'll be in your own echo chamber and think everything's great. Yeah.
I mean, I think if
Yeah.
somebody maybe presented the way it was tonight at the January meeting, I've not used it because I retired from my position
I'd
a
be
year
happy
ago,
to.
so I haven't been. I can't speak to, but everyone else that was there was just.
Yeah, I mean, if you guys want to represent it, that's fine. It was your message and I wasn't part of any of the discussion, so it's kind of like, here's the form, here's what they'd like to do with it, and there was really not a whole, they just, nope, no interest at all. So certainly Dr. Daly and Steve, if you guys want to, try again and give more information or more, that's fine.
Yeah, it's not an in-person meeting, so if you could, it's at 2:00 on Thursday to be January 17th, so if you could do that.
I think part of this education with Pulsera that needs to occur with hospital systems is I know that at least one of the hospitals that uses it, it may not necessarily be a nurse that's receiving the Pulsera information, more of a unit secretary. So we need to relay to them that this is a report, the medical report that's being given, and the expectation on EMS's end is that we're giving a report to a nurse when we send that Pulsera.
You know if the nurses are receiving it?
What's that?
The Pulsera communication.
So the crew does see
mostly
that
a
there's an
nurse?
acknowledgement by someone.
But you don't know if it's a nurse or not? You can't tell.
It does say
It does.
the provider level. I guess, let me
Could be like a
restate
tech
really
or
exactly
something.
what it is. There's when there's attempted communication, at least from what I've been told and what I've witnessed firsthand with the crew to the facility, there hasn't been any of that exchange back and forth. The acknowledgement, though, that it's like the information was received at that facility seems to be occurring. So.
And again, maybe with more of an update, if we can meet with that person prior to, or have her come to that meeting, we may be able to move forward with it too. Just that functionality. Okay, we'll bring you back to our meeting.
All right, anything else for Anne Marie? Can you just clarify, Anne Marie, when the next meeting is for the group?
It's January 17th, 2024.
January 17th will be the next meeting of the nurses committee.
Or
Thank you.
18th, I'm sorry, that's the Thursday, I apologize.
18th.
It's the 18th.
Okay, that's why I questioned it. I had the
Yeah.
18th written around the first time, and then I heard you say the 17th, so. The 18th,
Yep, it's Thursday.
all right. If you go on the 17th, you'll be early.
That's right. That's right. Nobody has one.
Trial run.
That's right.
All right. Moving on, PJMCI committee.
Yeah, Columbia County had a tabletop active shooter drill in one of our school districts in October. Was very beneficial. A lot of staff of the school district were involved, only because they declared it a superintendent's day and was mandatory that they be there, but I think they learned a lot. So during that time, we had our PSAP reach out to some of the other PSAPs in the area. Dust off our regional MCI plan so they at least knew where it was and what was going to be expected. We didn't request any resources, but we just wanted to make sure that they were familiar with the plan.
Excellent. Glad to hear that went well. Membership we already did earlier. Nominating committee remains open. If anyone has an interest in chairing that, please let us know. Carol, awards.
Nothing quite yet. We'll resume after the first of the year with our push for awards.
All righty, so start thinking about it for next year.
Right.
We'll move on to county reports. Albany County,
Nope, there's somebody on.
nobody on from Albany County. So there's no report. Columbia County,
Nothing significant to report.
all right. And Greene County,
Nothing to report.
nothing from Greene County. Rensselaer County,
Nothing from Rensselaer County.
nothing
I'm
from
sorry,
Rensselaer County.
I'm trying to get Ben Bornhorst. I was trying to get it to work. Just a few things. Still having EMT specifically staffing issues. We seem to be doing all right on medics across the board in the county. One other thing is that we had a meeting that was done with fire leadership, EMS leadership, with the assistance of Dr. Hayashi from Albany Med, looking at some of the EMS response issues that we're having in the county. And it's we just had the initial meeting, and now it's kind of splitting up into subgroups of looking at what our expectations are, what's being met, what's not being met, and then some possible solutions. So most likely more of a long-term thing that's going to happen here, but it seems to be moving along well, and nothing else at this time.
All right, thanks, Ben. If anything comes of those meetings and you have any great ways of solving those issues, I'm sure the other counties would appreciate the information.
Money.
Sir, yeah. Saratoga County, Tracy.
Nothing significant to report.
Okay, and Schenectady County, Jim.
Nothing to report.
Alrighty, that ends the county reports. Just going back to the chat, Peter Brody would like to know when the 2023 awards are going to be presented. I don't know that, Carol.
I don't know. Did we have? Oh, yeah, we did.
Currently, we don't have a date for that, Alan. Typically, we present those in late fall in an annual banquet. We haven't had an annual banquet for a couple reasons, namely COVID, number one, and financial constraints, number two. I advised Peter that in an email last week. I'll work with PJ, and if there's another budget amendment necessary, something to have something later this year, I'll let the group know. But as of right now, we don't have a confirmed date.
Okay, thanks, Tim. I would say with the holidays coming up that it's not going to be at least until 2024. So we'll regroup then and hopefully have an answer for you, Peter. Bylaw amendments, we talked about that already. We're
Hey,
gonna...
Alan,
Yeah, go
it's
ahead.
Steve.
Yes, Steve.
I'd like to suggest that the awards committee develop a awards presentation thing that not affiliate. If the money for dinner is an issue, why don't we just have an awards night with just some light refreshments? And that way we can present the awards in, sometime in the first quarter. But if we just kick the can down the road, let's get the committee to work on it and come up with there are probably other regions that do something like having Nice Vera had their awards thing, and it wasn't a dinner. It was, we had cookies and beverages, and gave out the awards.
That's a good idea, Steve. We can get together and chat about that. Good idea.
That's a great idea, Steve.
Thanks. I have one other question that just comes back into, I think it comes to, Alan, your announcement that we don't have a nominating committee. I think we're supposed to have elections of officers for next year. So if we do not have a nominating committee and we don't have nominations, so do our bylaws do our current officers simply continue until such time as we have an election? And are we in violation of anything? Because no one seems to be, we've asked for volunteers to be nominating committee for a number of months and no one's interested. So I think we have to contend with that. We're not having elections. And so how do we have officers?
Steve, I might be able to answer that question.
That'd be awesome.
Okay. So Maria Walker didn't drop from the committee. She dropped being chair of it. So there's at least 3 or 4 of us that are on the committee. There is just no one in charge of it. So like the membership committee, I see. Yep. I agree with the shrugs. Until I got back on membership, nothing was, taking place either. It'd be nice if someone did step up, maybe someone who's not a chair of a committee, one of the newer members would like to help us out.
Can you, Lynn or Steve or someone with a knowledge of what the nomination committee is for the newer members, just give a brief synopsis of what it is? So
I can
rather
do
than
that.
just seeing a committee that nobody wants to chair, it is probably intimidating to any new person to take it on.
So the job, and I can do it if you'd like. The job of the committee is to select the membership in writing for nominations for officers. People that wish to be officers have to send in a letter of intent that states that which office they wish to hold and talks about why they want to hold the office. The committee will then use those nominations to make a slate of candidate people that are qualified. So they will judge that people meet the qualifications for officer according to the bylaws. They bring that slate forward. They then must open up, and this is spelled out in the bylaws. They have to open up for nominations at an open meeting so that there can be other nominations. Those nominations have to be judged when they're qualified, and then we hold an election. I'm not sure how prescriptive our bylaws are about the process of that election. For the last several years, we have not had any contested elections, so they've simply been by voice vote. If I remember correctly, at a meeting, if there is a contested election where there's 2 people running for one office, then there has to be, due process in running that election. And so it can't be like raising hands. It would have to be by ballot. And then they announce the results and then they're done for the year. So really the job of the nominating committee is find out who wants to be the officer, make sure they meet qualifications, and make sure that they are meeting the statutory requirements. And I don't have all the statutory requirements in my head, but, Tim would be familiar, as the program agency head with what we're required to do to, or could easily find out. I mean, just like when Remsco elects officers, there's just certain procedures you have to do in order to make sure that they're legally binding, because we are, we are a quasi-state agency.
All right, thanks, Steve. So we can work on getting a description out to everyone to see if there's any volunteers. All committee chairs are appointed by the chairperson, so I would guess if nobody wants to do it, we'll make somebody do it.
Alan, it's Adam. I would be willing to volunteer for that.
Well, congratulations. Thank you.
Mm.
I will make that change, and we will make sure that you get all the information that you need and who's on the committee. I know Maria and Lynn are on it, and they've both been very active in the past, so I'm sure they'll be more than willing to help out with giving direction on that. To go back to answer Steve's question, the officers are elected at the January meeting, which is the annual meeting. However, they do hold their office until a successor is elected. So if there's any issues with that, then they remain until there is another election. All right. Going back, new business, there's 2 proposed operating budget modifications. The first one, and Tim sent this out with some explanation, to reflect the addition of the ACE MAP EMT student contract with St. Peter's Hospital for the hospital observation time. It's $600 annually. This was a non-budgeted expense in the budget because at the time the budget was developed, it was not known. However, it is it's really something, from my understanding, from what Tim and JC had to say about this, that is a expense that we really need to take on to be able to schedule our students in these classes or into the observation time. And if we don't, then we're just not going to have EMTs.
So, Alan, I'm a little confused because this is the first I'm hearing of this. And I'd really like to advocate for it on behalf of our EMT classes. But what I don't understand is how this is working across the other programs that are also trying to schedule EMT hours, and make sure that indeed that we're not, creating multiple different ways of doing the same thing. So if there's a way for us to pay for it for a month, I would say let's do that. But let's get more information about what each of the programs is doing so we can make a more informed decision as to what's going to ultimately best serve the whole region. Quite frankly, this sounds like a project for the academic committee. And the academic committee should work specifically to figure out the most effective way to use the limited amounts of opportunities that we have across the region for patient contacts.
Hey, Doc, it's Tim, and to the group, I have JC on, and perhaps he could speak to it a little better than I. But this is something that caught us off guard. But without St. Peter's participating in student placement, it's going to create a backlog in our students getting that required observation time. But I'm going to give the floor to JC, and perhaps he could explain it a little better to the group.
Sure, thanks, Tim. Yeah, just to give a little more info on it. As you guys might know, a couple years ago, DOH kind of changed our policies where students have to have 10 patient contacts as opposed to the hours. With like the number of classes we have and the number of classes we have operating at the same time, and the number of students, getting students sent out to get those 10 patient contacts can sometimes be a little bit challenging, especially when we have multiple classes running at once. ACE MAP is pretty much just to kind of give us another option for sending students out. Right now, we have some great partners in like Mohawk, Albany County, Colony, Malta, Monroe, great partners, but we have multiple classes running at once. It's tough to schedule that many students with the agencies that we have. So ACE MAP is pretty much a software that St. Peter's uses to schedule students for clinical rotations. We previously didn't use this. Well, when Dean Romano was working with us, he kind of helped us out to get those students squared away. Once Dean left, it's been a little bit more challenging to get students sent over to St. Peter's. Having an ED available for us is a big plus because if we send a student for a couple hours, they're likely going to get several contacts in those couple hours. So it's pretty much just another option for us, for me when I'm scheduling students and for the students themselves, if that makes sense.
So I had a question and a comment.
Sure.
My first or one thing, maybe they're both two questions, I don't know. In reading the email that you circulated, Tim, I was just I was thinking probably others would see this as well. I would be cautious in wanting to impose more fees on the students. And I know it was referenced, I think the $600 is a drop in the bucket for us as an organization over the year, but we're already taxing all of these students more and more. I would just be cautious, and maybe that would be reflective on the number of students that we'd be able to bring into the program if they know that there's even more that they need to.
I don't see this as a student-related expense. I see this as the Remsco foot in the bill for the annual subscription.
The only other expense was a $50.
It was $50 per person.
And that should be on the student.
Yeah.
Correct. So
With the contract, the annual contract fee, I first saw the Remsco.
Yeah, no, I've definitely for sure. I just seeing that component that the student was going to be, which I agree, it should be on them, but then I think then we have to question at the end of the year why the numbers of students coming in are so low, because we keep upping and upping the cost to go to class. And then I guess my second topic with this is, again, not knowing the ratio of students that are coming into these classes that are affiliated with an organization that could most likely ride with that organization. But has there been more of an outreach to all of the agencies within the Remo region to encourage further agencies? I know JC had specified 6 organizations on there. I'd venture to guess that there are many more that would or are currently participating, but is that also an option?
JC, can you speak to that?
Sure, absolutely. I'm just pulling up some of my notes here. So the $50 fee, it is something that, when I had kind of thought of this, it would be up to the student if they want to do this program. It's not something that we would require them to do it. It'd be, we would explain at the beginning of class and see if it makes sense for the student, if that's something they want to do. I have actually worked pretty extensively in the last couple of months to get more agencies on board. Like I mentioned, there was a few that we'd already kind of worked with pretty frequently, but in the last few months, I've made contact with, let me see here, Greenport, Ravenna, Catskill, Valatia, West Glens Falls. I've made contacts with those agencies as well, so we can send students their way. So it's definitely a big help, but like I said, it's still challenging. We can't obviously predict how many calls a student's getting. So just having the ED as an option would just kind of be a little more helpful. That way we know that if we're sending a student to the ED, they are going to have, hopefully a good chunk of patient contacts out of the way. But like I said, I have worked on getting more agencies on board, and we actually have expanded pretty well in the last couple of months.
I would suggest, JC, that there's something else we need to do here as well. So ACE-MAP actually, it looks to me, just in the brief amount of time I've been able to take a look at it here, that it's actually put together by a nonprofit out of Michigan. Oddly, Trinity Health comes out of Michigan. So I suspect there's an inherent relationship there. I think that what we should do at Tim's level, and possibly Jim's, or frankly, the chair of the academic committee, I would say that this falls to Don. They should have a conversation with St. Peter's Health Partners and the Trinity system as to exactly how this is going to work for all of the EMS educational programs in the region. This may be something that would be of benefit across the Albany Med Health system as well, depending on the price point, because quite frankly, scheduling students is a challenge. So there may be something that is of great benefit here, but let's look to see whether or not we can create a regional solution and benefit as many different people as we can, all at the same time. I'm with Steve on this one. I don't think imposing an additional $50 fee on our students is reasonable, particularly when at the end of the day, the hospitals want our students to be there and succeed. So let's look at this from a regional perspective and see whether or not we can create something that's a little more universal. Hi, this is Steve. Just following up on everyone else. It seems to me that what this would be if we do it the way it's today, it's a $50 student fee to go to St. Peter's Hospital, but everything else is free. If I got that incorrectly, let me know, but I don't think St. Peter's Health Partners would be excited to know that they're, it's a $50 to the EMT student, but everybody else, it's nothing. And I think there's an inequity in that being established. And again, I think a $50 fee on top of all the other fees is a lot to charge the student.
JC, I would suggest reaching out to SUNY Cobblesville because they use St. Peter's a lot as well, and they normally don't have a problem.
Sure. Yeah, absolutely. I think I did see them on the email when I talked to St. Peter's. I think they're on there with that program as well.
So let's stop recreating the wheel here, folks. We have an academic committee. This is an academic topic. Push this one directly to the academic committee to address the regional ramifications of this. All right. Let's use the committees that we have for the tasks that fall within their purview.
All right, any more discussion on this? It sounds like that there's no conclusion that's going to come out of this tonight, and it definitely does require some more research. So I guess going to the academic committee with this would probably be the best bet. Is there anyone who has any other ideas or objections to that? All right, Tim and JC, I guess if you could work with the academic committee on this and see if we can come to some sort of agreement on where this is going and go from there, I guess.
Well, it absolutely needs to be an immediate agenda item for the academic committee. I think, JC makes the point, this needs to be done quickly. So Tim can, work with Don, get it on that agenda. And, quite frankly, it's not a large amount of money. I have no problem whatsoever making a motion that if the academic committee comes up with a solution here, that this $600 expense be borne by the council. But I think we need to make sure that we have a cohesive plan from St. Peter's Health Partners.
I would second that.
All right. Sounds like a plan then.
Just a question. I don't know if anybody, I'm just kind of curious. Has there been any talk from St. Peter's Health Partners on refilling Dean's old position of having an EMS liaison?
I have had a couple of conversations about that, and there is no interest in it because there just is no room in their budget.
All right, moving on then. You have to forgive me because I'm not present at Remo, but the next item is a plaque. Either Carol or Tim or someone, can you handle? Is that to present it or to vote on it?
No, at the last meeting, I believe a suggestion was made to honor Jeff for his multi-year service to the Hudson Mohawk Regional EMS Council in the form of at least some type of retirement plaque. We had nothing budgeted for that. So I just wanted to throw that on there. I spoke to PJ about that as well, but I guess we're asking the group to approve a slight modification, probably no more than $250 to get some type of plaque to honor Jeff Williams' years of service to the council.
All right, I'm
I'll
assuming
make that
we need
motion
a
or second it.
motion and a second.
Jim Vena, I'll make that motion.
Then I'll
Okay.
second it.
Jim Vanna is going to make a motion that we purchase a plaque to honor Jim's service as a member of Remsco, or sorry, Jeff's service as a member of Remsco, not to exceed $250. And Lynn second that. Is that correct?
Correct.
Okay. There's a motion and a second. Any discussion on that? Hearing no discussion, all those in favor signify by saying aye.
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 Okay, any opposition signify by saying nay. And are there any abstentions to that? Okay, that motion passes for the budget modification for that. And Tim, you're going to take care of that?
Affirmative.
Okay, thank you very much. There is no old business. Any items from the floor tonight?
Yes, Alan. I'd like to make the motion that we don't meet in December.
I'll second that.
Okay, there's a motion and a second that we do not have our December meeting, which would be on Christmas. Any discussion on the motion and the second? Is there anyone who has an extreme opposition to this? Signify by letting us know now. All right. No objections to that. We will be canceling the December 25th meeting. The first meeting will be in January then. And hang on, I'll tell you the date. Looks like the 22nd, if I counted correctly.
You did.
So the first meeting will be the 22nd. Prior to that, hopefully the bylaws committee will circulate some information and we can have that ironed out. Adam, you and your nominating committee will work to solicit the nominations for the executive or the officers of the organization. And we'll have that information for the meeting on the 22nd. Is there any other information that anyone needs to bring forward? And if not, I wish everyone a happy and safe holiday. And
Alan,
yes, Lynn.
you need a motion to close the meeting.
Well, I know, but if I asked for
sorry.
that, then I wouldn't be able to say I wish everyone a happy and safe holiday. So got it. Thank you, though, Lynn. If there's nothing else, then I will entertain a motion to end the meeting.
I'll make the motion.
I'll second that motion.
All right. Lynn made the motion. It looked like it was seconded by Ben. Assuming there's no objections to this, so thank you everyone for hanging in there and bringing the some spirited discussion tonight. It was nice to have some discussion. This ends the meeting. Everyone have a great night.
Thank you.